Assalamu alaikum class. We are going to start our new topic from chapter hemodynamics disorder. So chapter is almost complete. There are just few topics are remaining, like edema is one of them. So we are going to start edema. In our today's lecture we will actually just deal with the introduction of edema and some basic types uh, uh, along with basic causes of edema. Okay, so let's start our today's lecture. As I already mentioned, that we will learn about basics of edema. Then we will go for causes of edema, and before causes we will classify edema. Then we will discuss sign and symptoms of edema and clinical features. But in our today's lecture we will actually try to understand the basic causes and basic mechanisms involved in the edema. Okay, so before going further, you have to keep in mind some normal physiology of human body. Our body have blood vessels, and in blood vessels even in the tissues, and there are two types of fluid uh, are present in our body. One of them, one type of fluid present inside the cells of the tissues. Okay, and the other fluid which is present in blood vessels and in the spaces between the cells in the tissues. Okay, spaces between the fluid present in the spaces between the cells, these are known as interstitial spaces, and the other and the interstitial spaces and in blood vessels. Okay, blood vessels and interstitial fluid are actually considered as interstitial is considered as an interstitial fluid, but another type is which is present inside the cells. Okay, there are two types of fluid. So let's move forward. So let's start edema. First of all, we should take a review of normal physiology of human body. So our body, 60% of our body weight is due to water. Okay, so in our body, 60% is water present, and this water is actually divided into two categories: intracellular water means a fluid which are present inside the cells. It means inside the cells means in cytoplasm, or in involved in many biochemical mechanisms. So intracellular water are the water which are present inside the cell. Okay, and from 60% of water, around two-third, okay, a major portion of water is present inside the cells in our body, and remaining one part of water is present actually in extra cellular spaces, like in interstitial spaces, like in blood vessels. Okay, so in our blood actually water is present. So one part from total 60% of body's water is present inside the present outside the cells in interstitial spaces, spaces between the cells in a tissue. Okay, keep in mind, spaces between the cells in a tissue is known as interstitial spaces. So extracellular water lives in the form of interstitial fluid. So if fluid is present in between the cells or in interstitial spaces, then we can say easily this fluid is actually interstitial fluid. Okay, so now from now we will say it interstitial fluid. Okay, Now another thing, from interstitial fluid, body's plasma contain 5% only. What is mean by body's plasma? Plasma is actually a part of our blood. Our blood is consists of two major parts, plasma and cells. Okay, so in plasma, which in plasma, from 5% of blood is 5% from interstitial fluid is present in plasma, and it runs in the blood vessels. Okay, so interstitial fluid are fluid present between the cells in a tissue. Okay, and body's plasma fluid are those which present inside the blood vessels, move in the blood. Okay, then edema can happen in the body's cavities. Okay, so now location where we can observe edema, or edema can happen anywhere in a body. Okay, what is edema, we will define it in our next slide. Edema can happen in our in any part of body. Our body have many cavities, like peritoneal cavities, pleural cavity, like many other cavities. But actually, so edema can also happen in cavities. Okay, if edema happens in the cavities of the body, then we say a special name, effusions. Okay, then a fluid in the cavities of the body is known as effusion. It may be a side, it may be pleural effusion, it may be hydrothorax, and anything else. Okay, so these are some basics about distribution of fluid in our body. So if you are completely understood this, then it will be easy for you to understand edema. Okay, so uh, before going forward, let's define edema here. What is edema? Edema is actually increase in the volume of interstitial fluid. Okay, a simple thing, a fluid which is present between the cells. Okay, this is known as interstitial fluid. But now focus, increase in the volume of interstitial fluid. It means, from this definition you can easily understand that fluid is present, already present, but limited or a control or in a controlled quantity. But if fluid volume gets increased abnormally in the interstitial spaces, then it will cause edema. It is edema. Okay, I am going to repeat it. If a volume of interstitial fluid rises in the interstitial spaces, then we say it is a edema. Okay. For example, hydrothorax. Hydrothorax, it means thoracic cavity, increase accumulation of fluid in the thoracic cavity. Then we can say it's a hydrothorax. Then what is anasarca? Another important term. Anasarca is a severe generalized edema in the body. It means it is not localized. A whole body suffers with the edema or swelling. Then we can say it is actually severe generalized edema. So now another thing you have to keep in mind, if volume of interstitial fluid increased in the interstitial spaces, then size of tissue or organ all increases. Okay, if size increases, we can say it's a swelling. Okay, so it means we can apparently see the edema. Okay, so sometime we say apparent increase the volume of the interstitial fluid in the interstitial spaces. Okay, so just in a short note, increase in the volume of interstitial fluid in the interstitial spaces. So edema is associated with many diseases, but sometimes edema cause of edema remain unknown. This slide is very much important. How? Because from this slide you will be able to understand basic mechanism involved behind the edema. Okay, so some basic mechanisms. What are some basic mechanism? First of all, before going to the basic mechanism, imagine a diagram, imagine blood vessels in your mind. First of all, there are arteries. Arteries are connected with the then another corner is of veins, and capillaries are present in between them. Okay, so you can observe in diagram of in left corner where filtration is mentioned. Here is an artery, arteriole is present, and in right side where blue arrows are present, these are actually venous side. Okay, from arteries blood from arteries oxygen moves out, or filtration of many things occurs, and from veins reabsorption occurs. So from venous side reabsorption is increased. Why these mechanisms occur? There are two major things which are involved in the transportation of fluid from arteries, movement from artery to out of the cell, and which is a cause, or which are the causes which are involved in the that causes reabsorption of fluids from the interstitial spaces into the blood vessels. Okay, now you have blood vessels in your diagram. Okay, in left corner where arterial end is present, there are there is a thing mentioned, net filtration presence 10 millimeter of mercury. Okay, now leave. First of all, try to understand vascular hydrostatic pressure. What is the role of vascular hydrostatic pressure in the edema? Keep in mind, if vascular hydrostatic pressure increases, fluid move out from the blood vessel into the interstitial spaces. Okay, when fluids move in the air, accumulate in the interstitial spaces, it causes edema. Okay, so increase in vascular hydrostatic pressure cause edema. On the other hand, colloidal osmotic pressure, ठीक है? So decrease in colloidal osmotic pressure causes edema. So now another thing, now मैंने जो आपको कहा कि increase in vascular hydrostatic causes edema, और accumulation of fluid from the arteries. So a special type of pressure is present due to hydrostatic or water molecules inside the blood vessels. When pressure at arteriolar and hydrostatic pressure usually remain high as compared to venous end. So at arteriolar and in blood vessel, hydrostatic pressure is more than from venous side. Then fluid moves out from the arteries into the interstitial spaces due to increased hydrostatic inside the blood vessel at arteriolar end. Now, so another thing is at the another end, from where at the right corner venous return. So increase, so at venous end hydrostatic pressure remain decreased and osmotic pressure remain high. Osmotic or oncotic pressure are due to actually major involvement of proteins. Okay, so in arteriolar end, hydrostatic pressure is more than osmotic pressure. At venous end, osmotic pressure is more than hydrostatic pressure in the blood vessels. So due to increased hydrostatic pressure at arterial end, fluids move out from the arteries into the interstitial spaces, and from the venous side where osmotic pressure is increased as compared to hydrostatic pressure, then reabsorption of interstitial fluid back into blood vessels occur. Okay, it means you can easily understand it. So another thing, sir, what are these things mentioned? Net pressure, or net arterial and net filtration pressure, and venous and net filtration pressure. So what is this? Now discuss this thing. Uh, at arteriolar and normal hydrostatic pressure is actually 35 millimeter of mercury. 35 at arteriolar and no normal normal hydrostatic pressure remain around 35 millimeter of mercury, uh, where at arteriolar and osmotic pressure is less than a hydrostatic pressure, and osmotic pressure remain 25 millimeter of mercury. So if we minus hydrostatic pressure, if we minus osmotic pressure from hydrostatic pressure, then we remain plus 10. We get a result of plus 10 millimeter of mercury. It means if a result is positive, then fluid will be moved out of the cell. So net rate of, or net filtration pressure is plus 10 millimeter of mercury. Okay, at on the other hand, at reabsorption side or in venous side, hydrostatic pressure is 18 millimeter of mercury. Hydrostatic pressure is normal, at venous side is 18 millimeter of mercury. um, but at but osmotic or oncotic pressure is remain same of, or 25 millimeter of mercury. Okay, so if osmotic pressure is greater than hydrostatic pressure, then net filtration rate will be -7. It means if a result is minor, then fluid from out will move into the blood vessel at the venous side. Okay, so this is actually a normal mechanism. If fluid moves from arterial and into the interstitial spaces, then from venous side fluid will also move into the blood vessel again. So the balance between these two mechanism, balance between this mechanism is necessary. If hydrostatic pressure, due to any reason, if hydrostatic pressure increased much high but osmotic pressure remain same, then it will cause severe accumulation of interstitial fluid in the interstitial spaces. It will cause edema. Or if sometime osmotic pressure is decreased due to decreased protein level in body, if is osmotic pressure in the blood vessel is decreased, then reabsorption will be slow, or reabsorption will be hard. So if reabsorption will be slow due to decreased osmotic pressure, then accumulation of excessive fluid in the interstitial spaces occur. So these two mechanisms, increase hydrostatic pressure and decrease osmotic or oncotic pressure, will cause edema. So here a diagram, hopefully you are easy to understand these things. So another important thing, classification of edema. Actually, there are two major classification of edema: pitting edema and non-pitting edema. What is pitting edema? Pitting edema is when pressure is applied to a small area. The identification persists for some time after the release of the pressure. Peripheral pitting edema is the more common type, resulting from water retention. Now simplify this. If patient is suffering from swelling, और आप उसको प्रेस करते हो, swelling को प्रेस करके, edema है, आपने उसको प्रेस करके थोड़ी देर थंब से ज़ोर से प्रेस करके उस swelling को छोड़ दिया, बट 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 आइडेंटिटी रह गई वहाँ पर, जहाँ पर आपने प्रेशर किया था वहाँ पर जो है आपको ग्रूव नज़र आ गया. ओके, इफ़ your if this remain for few minutes, this a pressure indication of pressure remain for few minutes, then we will say it's a pitting edema. Okay, mostly pitting edema occurs in periphery, means lower limb, or in upper limbs. Okay, Then it can be caused by systemic diseases, pregnancy as a result of heart failure, or local conditions such as varicose veins, thrombophlebitis, insect bite, and dermatitis. So this is caused by systemic diseases. Mostly pitting edema occurs due to systemic disease. There are few causes of it. We And then we will actually discuss the causes, general causes of edema in our latest slide. Like these are actually overview of causes of pitting edema. Okay, so from this you have to keep in mind systemic diseases. It actually commonly pitting edema occurs due to systemic diseases. Now, another type is non-pitting edema. Non-pitting edema is observed when the indentation does not persist. It is associated with such condition as lymphedema, lipedema, and myxedema. In very simple wording, अगर आपने किसी स्वेलिंग को प्रेस किया है थंब के साथ या फिंगर के साथ कुछ देर के लिए, और आपने जो ही उसको छोड़ दिया, तो उसके बाद क्या होगा? अगर आपको वहाँ कोई आइडेंटिटी नज़र नहीं आती, देर इज़ नो आइडेंटिटी ऑफ योर थंब ऑन द, एंड विद इन सेकेंड वो आपने जो प्रेस किया था वो नॉर्मल हो जाता है, जैसे स्किन है, बाकी बॉडी का पार्ट है, देन इट विल बी अ नॉन पिटिंग एडीमा. इट्स अ स्वेलिंग, इट्स edema, but actually identification does not persist, then we'll say it's a non-pitting edema. Okay, so there are few example like lymphedema, lipedema, myxedema. So these are some there are these are two important types or classification of edema: pitting edema and non-pitting edema. Okay, in pitting edema identification remain persist, but in non-pitting edema identification does not persist. Okay, so these are actually important things. Now you can observe something in left side diagram. In left side diagram you can see uh, indication of or you can see identity of thumb at the feet of the fitting edema patient. ठीक है, but at right side uh, no doubt at right side no doubt uh, is no doubt edema is present, but it's not pitting edema. You cannot observe any identity of your thumb or a finger here. Okay, another important thing actually uh, about the fluid of edema. Accumulated fluid can be of two types, like transudate or exudate. Transudate, which fluid will be a transudate? If accumulated fluid is filtrate of blood plasma without change in endothelial permeability. Okay, I'm going to discuss. You have a blood vessels and fluid. If fluid came out from blood vessel in normal circumstances or accumulated more than its normal value, but and there is a no a prominent change in the permeability of blood vessel, but if fluid accumulation occurs, then it will be transudate. And sometimes and mostly transudate fluid occurs in non-inflammatory edema. It means no inflammation is present, there is no indication of phagocytic cells or bacterial, or then it will be a in transudate protein will be less in number, because there is no change in permeability. Protein will not move excessively from blood vessel into the interstitial, then protein value will in the transudate will be less or no protein sometime. Then glucose value will be same as in the blood or plasma. Specific gravity will be 1.015. Ph will be equal to blood plasma, and few cells, mainly mesothelial cells and cellular debris, can be seen in the in the transudate. Okay, so edema is congestive cardiac failure, for example, ठीक है, ट्रांसुडेट fluid can be seen in edema in congestive cardiac failure. Okay, exudatory edema can be seen in inflammatory edema, where inflammation, if inflammation is localized inflammation is present, or WBC accumulation of WBC is present, then we can say it's actually a inflammation. It's actually uh, uh, inflammation. So when inflammation occurs, then fluids move out from the blood vessel into the interstitial spaces. During this process, vascular permeability increase due to inflammatory mediators. Okay, so in infection, in inflammation, or increase in, or it due to vasodilation or increased vascular permeability, fluids move out from the blood vessel into the interstitial space. It mostly it will be exudate fluid. Okay, so what is the property, what are the properties of exudatory fluid? This is a high in proteins are present in high amount, 2.5 to 3.5 gram per deciliter. Okay, and glucose will be low in this, and specific gravity 1.018, and pH it will be same, will remain same as for blood. So inflammatory as well as parenchymal cells, so it will be from due to inflammatory as well as in which in exudate we can say, we can observe cells, inflammatory cells, we can say, or parenchymal cells as well. And sometimes, mostly it will be a purulent exudate in which pus will be present. So exudatory fluid in pus will be, or pus or neutrophil cells mostly present inside the exudate. Okay, so these are some important things about the fluid type which present or accumulated in the interstitial spaces. So differences are most important because in UHS many questions are will be asked from these things. Okay, thank you so much.